Namaf CEO further explained that among the introduced interventions is the structuring relationship between medical aid funds, private hospitals and facilities aimed at improving the efficiency and effectiveness of healthcare services provided and containing the wastage of scarce financial and other resources.
If I may pause here again, utilization in our context is where more services are purchased. Think of it as your own bank, where you have your money in your bank account. The frequency at which you are drawing from your account would determine whether you would have money in that pool or not. So when we are saying utilization, it speaks to the frequency of services bought and the need for medical aid funds to have to pay. So here we are talking about volumes, not necessarily the cost per intervention. So that is what utilization is. So because of these outflows of money that are associated with utilization, the medical aid funding industry decided upon a strategy to strictly apply the Namaf billing rules and guidelines and international coding convention in order to address utilization.
In addition, Namaf CEO stated that results of analysis performed and reports by the medical aid fund administrators in Namaf suggest that clinical coding issues are highly prevalent in the medical aid fund industry. Namaf CEO added that Namaf billing rules and guidelines, as well as international coding conventions, must be achieved to address utilization.
That 31% of the 5 billion is paid to private hospitals. So that being the major driver of cost, there was a need that between the hospitals, facility and Namaf, we need to collaborate in a way that will address the drivers of care, of cost within hospitals. And it was found to be predominantly some concepts or services that these facilities are providing, which is amongst other a definition to differentiate between what a minor and a major case is, what and how unattached operating theaters should be working, how subacute facilities should be operating, what physical rehabilitation centers should be providing. There are also drug and alcohol rehabilitation centers. And then there is high care and intensive care units. So these are some of the concepts that are really mixing up the way how funds are built by the service providers.
Namaf CEO notes that the sustainability of the whole medical aid industry will in all likelihood affect the healthcare service providers and the healthcare industry at large.